Today on Retiring Well with Michael Reese, we are addressing the future of healthcare.
How's Medicare looking? Because that's the healthcare plan for people who are retired, right?
How will healthcare costs and the fast increasing Medicare liability affect you?
You need to expect that you're going to have to pay more. You're going to have to pay more copays, you're going to have higher deductibles, you're going to have you're just going to have to pay more.
We'll share helpful information so you can make educated decisions and manage your financial risk.
If you want to transfer risk, there are 3 ways that you can do it. And so let's go ahead and cover what they are.
All this and more on Retiring Well, starting right now.
Retiring Well with Michael Reese, helping you make smart decisions with your money so you can live a better life. Today is the day you can take back control of your money. Retiring Well with Michael Reese, where we believe your best is yet to come.
Welcome to Retiring Well. I'm your host, Michael Reese, and folks, we have a great show lined up for you today on a topic that I don't know that anybody really wants to talk about, but it's an important one. We're going to talk about healthcare. And we're going to talk about how there's, all of these unknowns with healthcare in the future. I'm going to try to help wrap our arms around that a little bit and give you some good planning tips dealing with what is essentially an unknown cost in the future. But before I do that, like I do every week, I want to take a minute and share with you why we do this show. See, I believe your best is yet to come. You're facing the second half of your life. This is a time where you can pursue what's meaningful, what adds fulfillment in your life. This is where you get to do all the fun stuff. But you also have to recognize that this is the same period, retirement, that's a lot like 20 to 30 years of unemployment. 20 to 30 years of paychecks not coming in. And here's the deal. All your life you work, right? You're working, you're adding money to those accounts. You're getting a paycheck, you're adding money to your accounts. Well, once you retire, you hit the day where you're not working anymore. The paycheck isn't coming in anymore. And now instead of adding money to your accounts, you need to take money out of your accounts. You need to make smart choices with your money. The entire financial industry, they tell you how to add money to your accounts. They tell you how to grow, how to accumulate, but they don't focus on the other side. Once you've retired, how do you take that money out? How do you protect your nest egg? How do you pull that money out in intelligent ways? How do you still grow your nest egg while you're doing all of that? It's a completely different discussion. That's where we come in. That's where the show comes in, is to give you a different perspective from everyone else so that you can spend your time doing what you want to do, enjoying your life, and not have to worry about, are you going to run out of money? Kind of important, huh? All right, let's go ahead and jump right in. Every week, I ask you, have you called the show? Have you called the number on the screen? If you haven't, call now. Get your complete retirement review done. It's absolutely free. There's no charge. Here's what we help you take a look at. What's your retirement income plan look like? 20 to 30 years of unemployment. Where are your checks coming from? Where's your paycheck coming from? Not a job. It's got to come from the portfolio. How's that look? What about a risk and cost analysis on your portfolio? How much risk are you taking? How much are you paying your money managers? Here's what I know. I know odds are very, very high that both of those answers you might think you know, you don't have a clue. It's very common. People call the number, they come in, and the risk they're taking is very different from what they thought, and or the costs that they're paying are higher than they thought. And of course, taxes. Nobody wants to give the IRS a bunch of money. How do you keep your taxes to a minimum? We cover all of that in a complete retirement review. Call the number on the screen. Let's get that done. Let's go ahead and talk a little bit about how our government's spending money and how it's going to affect your health care. This is our favorite cartoon when talking about how the government spends money. It says we don't spank them anymore, we just tell them how much they owe on the national debt. I love that. I think it's hilarious. Well, it'd be funnier if it weren't true. I guess is what I'm saying. And so what I want to do is take a minute here. I'm going to run over to my computer. I'm going to bring up a website called usdebtclock.org so we can take a closer look at what the government's promising, but they aren't collecting money on, and how that affects what's going to happen to your health care. Here we have the website usdebtclock.org. If you haven't been there before, it's a great site. And I've kind of zoomed it in so you can see it pretty easily. There's a lot of really good information on this website, and it's all sourced by just impeccable sources. And it's all done in live numbers, which is fun. You can see the U.S. national debt here. Look at that, $18 trillion with a T, trillion. That's about $57,000 per person. Not like a household or anything, just per person. And the reality is we could all kick in 57 grand a year, which, by the way, no, we couldn't, because the overwhelming majority of people don't have that much money. But we could all, even if we did, it wouldn't stop this number. This number keeps going because the folks in Washington, D.C., their idea of budgeting is let's spend a whole bunch more money every year than we take in. You know, if you and I did that, they would call it bankruptcy. Well, but the government can print money, so they get different rules. But that's not what I want to focus on as the debt today. What I really want to focus on is Medicare. Because remember, the debt's $18 trillion with a T. How's Medicare looking? Because that's the health care plan for people who are retired, right? Let's take a look. Social Security, Medicare. Look at those two. Oh, $27 trillion. Look at that. That's a bigger problem than the national debt. That's a bigger problem. So here's what's going to happen. I mean, we are all freaking out about the national debt. Medicare is a way bigger problem. Why aren't we freaking out about that? It's because nobody talks about it. Nobody's telling you. Here's what you need to understand. And by the way, look at this. Social Security, here's 14. Medicare is twice as bad as Social Security. You know, on your Social Security statements, you see that, oh, look, in 2033, they're going to run out of money, right? They're going to run out of money, and your benefits are going to get reduced. What do you think is going to happen to Medicare? You absolutely need to expect a couple things with your health care while you're retired. You need to expect that you're going to have to pay more. You're going to have to pay more copays. You're going to have higher deductibles. You're going to have you're just going to have to pay more. Your premiums are going to go up. And guess what? You know what the most expensive thing is about health care in retirement? You know what that is? It's long-term care. Whether you receive that long-term care in your home or in some kind of facility, that's the most expensive part. And you know what? They don't pay it now, and they're just going to pay even less later on. So here's the deal. You need to recognize this healthcare costs are going to go up. You got to prepare yourself for that. Now don't go away. Coming up after the break, we're going to start talking specifics about what these costs look like and where they're heading.
Your grandchildren are precious to you. They are your life. This is your time to have that special relationship. Taking care of yourself is taking care of them. Centennial Wealth Advisory is offering a free, no-obligation retirement review to make sure you don't run out of money during your retirement. Centennial Wealth Advisory. Your best is yet to come.
Do you know that there is one mistake that we see retirees make, or those who are nearing retirement make? And we see them making that mistake over and over and over again. That mistake is simply this. They are taking too much risk with their portfolio. It's almost like it's the fourth quarter of a football game. They're up by 10, they've got the ball. All they got to do is make sure they don't fumble it away. Well, here's my question for you. What about you? Are you taking too much risk, or are you getting ready to fumble the ball? Well, how do you find out? It's really simple. You just go to our website, sun-wealth.com. In the upper right-hand corner is a link for your free portfolio stress test. Click the link, follow the instructions, and the results will come to you immediately.
Essential financial strategies for a comfortable retirement. Join TV host and certified financial planner Michael Reese for an informative and exciting presentation with complimentary gourmet dinner and learn how to protect your assets from market volatility, how to find growth and security in today's volatile market, how to prevent outliving your money, how decisions in Washington, D.C. are affecting your retirement, how to safeguard your assets from unnecessary taxation, the 4 ways to make sure your advisor is giving you expert advice, and much more. We offer the following dates and locations to choose from. August 11th at Maggiano's Little Italy. August 13th at Ruth's Chris Steakhouse. Presentations start at 6:30 p.m. and are free to attend with a complimentary gourmet dinner to follow, but seating is limited and fills quickly. Call 888-608-5825 or visit send-wealth.com/events to reserve your seats today. Don't miss this important presentation, Essential Financial Strategies for a Comfortable Retirement. Call 888-608-5825 today.
Welcome back. We just got done looking at a wonderful little website called usdebtclock.org that shares with us our government's idea of fiscal responsibility, something that each and every one of us, you know what, you look at these numbers, you scratch your head, you think, what is wrong with these idiots in D.C., right? They are clearly just not doing their jobs. Nevertheless, we could spend a whole series of shows on that. We're not going to do it. Instead, we need to talk about what are the consequences of them spending money like crazy. And we see that Medicare is a bigger problem than Social Security. It's a bigger problem than our national debt. It's a major deal. So we know expenses, your healthcare expenses are going to increase down the road. And what are we going to do about it? Well, we have to start by taking a look at some of the biggest expenses, which are long-term care. I know you don't want to talk about long-term care. I know you don't want to talk about it. But we have to be adults, and we have to face facts that half of people out there need some kind of care before they die. And that care hopefully is in home. That's where we want it to be. And sometimes it gets bad enough we have to go to some kind of facility, assisted living, nursing home, what have you. And so it's real important that we understand, what kind of risk exposure, what kind of cost exposure do you have in these types of areas. So what's really helpful is Genworth does something called a cost of care survey, and they do it specifically for each state. Okay, so every state has one. And I'm going to walk over the whiteboard. I'm just going to share some numbers with you that help understand where some of these costs are today. So let's go ahead and take a look at in-home care. So how much is in-home care cost? What does that cost to have someone come in your home and help take care of you? Typically, you're looking at about somewhere in the range of $45,000 per year. Now, here's what we need to understand. It's not normally 1 year. Normally, when people need care, on average, it's closer to 3 years. So if you do the math, what do we see? Well, that works out to a cost of about $135,000 today. Now, I know, here's the good news. You're sitting there, you're watching the show here and you're saying, whew, good news, I don't need care today. It's going to be a while. I mean, I'm healthy today. It might be 10 years, it might be 20 years later before you need any kind of care. Well, here's what you need to know. That number's not static. It's going up faster than the rate of inflation. 20 years from now, I mean, what if you're 50 years old today, maybe, or 65, and maybe 20 years you're 80, 85, and that's when you need care. 20 years from now, this total cost could easily be closer to $400,000. Just to have someone come into your house. Do you have the money set aside to pay for it? Well, what if you need to go to a nursing home? As you can imagine, that costs a little bit more. That's a little pricier. According to this, this one's about twice this much, about $90K per year. So that makes the math easy, doesn't it? If you need to be there for 3 years, that means that today, $270,000. Now imagine that one. Now the numbers are getting serious, right? And who knows, if you need care 20 years from now, what are we looking at? Maybe closer to $800,000. Now, let's talk about the reality of some of these numbers. Here is what we know. It's very common when you have a married couple that one of the couple, the husband or the wife, ends up needing care. Now, I want you to imagine this for a minute, because this is kind of, this is real life. Imagine that you're married and your spouse, it's not you, it's your spouse. They have a stroke. They get Parkinson's. They get something where they need care. And at first, what do? You try to stay home. This is what happens. We try to stay home. And we start hiring people to come in and help out. It's just reality. That's what we need to do. And as you do that, you start spending money. Then things get worse. Things deteriorate. And you go from this column, and then you have to start working over to this column. When all is said and done, it's not today, it's down the road. When all is said and done, you realize that you spent $500 grand, $600 grand on care. And your retirement accounts, which were doing fine and paying you income, after that huge cost, are now, well, they might even be depleted. They might be gone. And then the person in the nursing home dies, leaving the healthy spouse, you, at home with what? Either nothing or close to nothing. That happens every day. That is reality. You need to be an adult. You need to look at these numbers and you need to say, okay, how am I going to take care of this? Am I going to take on the risk myself? Are you going to take on the risk yourself, or are you going to transfer the risk to, say, an insurance company? Coming up after the break, I'm going to share with you the different ways you can transfer risk so that you can make an informed decision as to what makes sense for you.
Essential financial strategies for a comfortable retirement. Join TV host and certified financial planner Michael Reese for an informative and exciting presentation with complimentary gourmet dinner, and learn how to protect your assets from market volatility, how to find growth and security in today's volatile market, how to prevent outliving your money, how decisions in Washington, D.C. are affecting your retirement, how to safeguard your assets from unnecessary taxation, the 4 ways to make sure your advisor is giving you expert advice, and much more. We offer the following dates and locations to choose from. August 11th at Maggiano's Little Italy. August 13th at Ruth's Chris Steakhouse. Presentations start at 6:30 p.m. and are free to attend with a complimentary gourmet dinner to follow, but seating is limited and fills quickly. Call 888-608-5825 or visit send-wealth.com/events to reserve your seats today. Don't miss this important presentation, Essential Financial Strategies for a Comfortable Retirement. Call 888-608-5825 today. You've worked hard for your money and your best is yet to come. You've reached a point where you don't put your money at risk anymore. The road ahead doesn't scare you because your money is secure and working for you. Centennial Wealth Advisory, portfolio stability, tax reduction strategies, lifetime income, financial security in any economy.
Did you know that the best financial advisors in the country never put mutual funds in their clients' portfolios? In fact, they avoid mutual funds like the plague. Yet I'm betting that if you look at your portfolio, your retirement savings, you're probably sitting on a lot of mutual funds. There's a bit of a disconnect going on there. You need better information. To give you that information, we've delivered a free report on our website. It's called Mutual Funds, the Good, the Bad, and the Fine Print. Absolutely free to you, and here's how you get it. You go to our website, send-wealth.com. When you get there, over here on the left, it's right here, you'd simply put in your email address and click submit, and it'll be sent right to your inbox. Welcome back. This week we're talking about how our government's spending a bunch of money, how Medicare is a bigger problem than our national debt and Social Security, and the impact on you when you need long-term care. And we saw from Jen Worth's study that, hey, these are some of the numbers you need to be looking at. This is the kind of cost, this is the out-of-pocket expense that you're looking at down the road should you or your spouse need care. And the question is, do you want to self-insure, meaning are you willing to take that on for yourself, that cost, where you say, hey, I've got enough in assets, I can handle it, or do you want to transfer risk? And when I say transfer risk, I mean, do you want to go to an insurance company and say, you know what, I want to give the insurance company some type of payment today so that I'm able to have them take care of some or all of these costs. Now, there are three ways. If you want to transfer risk, there are three ways that you can do it. And so let's go ahead and cover what they are. Number one, traditional LTCI, long-term care insurance, traditional long-term care insurance. This is like car insurance. You pay a premium to insure against some of those expenses. If you need care, they pay based on whatever the policy dictates. Just like car insurance, if you get in a car accident, they pay based on what the policy dictates. If you never need long-term care, you get none of your premiums back. Just like if you never get in a car accident, you get none of your insurance premiums back. Now, none of these are good or bad, it's just how it works. Now, the benefits of this approach is that you can often get a pretty good amount of coverage for a reasonable price, but the disadvantages here are many. Number one, it is the hardest type of insurance to qualify for because no insurance company really wants to be in this business anymore. Number two, it is expensive. Even though it's a reasonable price, it's still pretty expensive. Number three, whatever the premium level is, they're going to increase in the future, just like healthcare insurance premiums increase. So it's not a stable premium level. In today's environment, we're seeing a lot less of this done. Option number two, some kind of an annuity with a long-term care rider. That's another option, a long-term care rider. So there are insurance company accounts called annuities out there today. You've probably heard of them. They have oftentimes some long-term care riders where if you need long-term care, whatever that annuity is paying you in income, that income might, say, double for a period of 5 years to provide some benefit to defray some of those expenses. Now, the good news is they're often very, very inexpensive to do this. It's very, very cheap. However, the bad news is that the benefits are usually not very large, but they do help particularly defray some of the costs for in-home care. The third one, life insurance. This is the one. Life insurance, especially with long-term care benefits, this is the one that we see done with increasing frequency. Because the neat thing about life insurance is designed properly, the premiums are guaranteed to be level. The benefits are pretty large and guaranteed to be level as well. And you're going to get paid. You will get paid. You're going to die, so you get paid that way, or you get your long-term care benefit, one of the two. But when it comes down to handling these costs, again, you can self-insure or transfer risk. These are the options if you transfer risk.
Essential financial strategies for a comfortable retirement. Join TV host and certified financial planner Michael Reese for an informative and exciting presentation with complimentary gourmet dinner, and learn how to protect your assets from market volatility, how to find growth and security in today's volatile market, how to prevent outliving your money, how decisions in Washington, D.C. are affecting your retirement, how to safeguard your assets from unnecessary taxation, the 4 ways to make sure your advisor is giving you expert advice, and much more. We offer the following dates and locations to choose from: August 11th at Maggiano's Little Italy, August 13th at Ruth's Chris Steakhouse. Presentations start at 6:30 p.m. and are free to attend with a complimentary gourmet dinner to follow, but seating is limited and fills quickly. Call 888-608-5825 or visit send-wealth.com/events to reserve your seats today. Don't miss this important presentation, Essential Financial Strategies for a Comfortable Retirement. Call 888-608-5825 today.
Let's go ahead and recap our show today. First, healthcare during your retirement. Hey, it's going to change. You know it's going to change, and those changes are likely not going to be improvements. It's likely not going to get better. It's likely going to get worse. The costs of care, they just continue to rise. They're expensive today, and it's just getting worse. And of course, when it comes to things like long-term care, you need to decide, are you going to self-insure? Can you afford to self-insure, or do you want to transfer risk? And it doesn't make sense for you to transfer the risk to an insurance company, and look at the different ways that they do it. We covered traditional long-term care, using annuities, and life insurance. So here's my question as we wrap up the show today. Have you called yet for your complete retirement review? Call the number on the screen. Just do it now. Call, visit with us. It's absolutely free. We'll help you take a look at your income plan, your investments, risk and costs, taxes. And we'll also help you with your health care. We'll help you look at these different options that we talked about today so that you can make an informed decision, one that makes sense for you. Because let's be honest, what makes sense for you may not make sense for the next person. So call the number on the screen, visit with us in the office. Let us help you with all of these areas, with your health care planning. What did we say? Retirement is 20 to 30 years of unemployment. You've got to make smart choices so you can get to the other side safely, comfortably, and securely. All right, that's our show this week. Hope you have a great weekend. Take care, everyone.